right, all right. Welcome. It's a Little Crazy Podcast. I am David McGee. With me is Phoebe Goodwin. Phoebe.
Hello, David.
Hey. So, I'm kind of known as a dog with a bone on ideas. And it, like many people, it's one of my strengths. It can almost be a weakness, though. I get my mind set on it. People think I have all these ideas. I don't actually have a lot. But it's like when I get my head on one, when I get my idea on one, I don't easily let it go. I tend to push and try to make it become a reality. So in this case, probably 2011. The year is 2011, and really into 2012. My family's undergoing some crisis, and people think the William Magee Center for Alcohol and Other Drug and Wellness Education at the University of Mississippi came about from an idea after our late son William died. But in reality, I went back through some emails recently. I actually sent a message to the provost at the University of Mississippi in the that 2012 time period. And I said, one day, I don't know how I will get there, and I'm not sure how we will do it, but I will get back home, and we're going to do something different for students and helping them around substance misuse and other issues they face in a different way on campus. I sent that message. I had no idea what it even meant, But So here we are today.
Here we are,
and it's probably the guest, just got to be honest, I'm singularly most excited about. That's saying a lot. We've had my son, we've had my daughter, we've had it's not diminishing them. It's because out of that kind of crazy idea, because what happened is then we lose our son, William. But it's not just the losing him. What happened is our son, Hudson, then finds success in recovery. I do. And our daughter, Mary Hallie, finds success in recovery. And what I see is what is possible with support. So the opportunity comes to move back to Oxford, Mississippi, and that crazy idea in the beginning, we're striking for that.
Right. And this time you don't have any patience.
Oh,
You're
I'm
ready
done
to get
with
it done. Yeah.
I'm out of it, and I've decided it's happening.
Mm-hmm.
And I come back to town, and it's the summer of 2016, and the effort begins. So, this is truly celebrating a little bit of these crazy ideas people have, because today it's reality. Mm-hmm. Our guest today is Dr. Nick McAfee. He's a PhD in counseling psychology. And most importantly, Nick is the director of the William Magee Center for AOD, that's Alcohol and Other Drug, and Wellness Education at the University of Mississippi. And in case you got somewhere lost in the storyline, that's named after my late son. Nick, if I don't cry sometime in this episode, something is wrong. I remember, Nick, when you interviewed for the job. Phoebe, the setting is this. He's in his final interview, and Nick gives his presentation. They invite me just because I'm a stakeholder in this movement. And Nick finishes his presentation, and I know it's our person. And I walk up to talk to you, Nick, and I've just got tears in my eyes, and I can't even speak because I knew this is real and it's game on. So tell us, first of all, what led you to this work? What makes you compelled and called to do this work in the first place?
Yeah, so this goes way back. And, if you talk to most psychologists, they don't tell you, whenever I was in high school, I wanted to be a psychologist. Mm-hmm. And I didn't know what it meant in high school, but I knew it's that's really interesting to me. I want to work with people. And there was just this really interesting confluence of life events, my own personal interests. So a lot of people who work in substance use and recovery and all these different areas have their own personal experience with recovery. That's not me. My experience is witnessing other people around me struggling or learning after the fact that people had been struggling, people I'd known since early childhood, but never had a clue. And so thinking, how do I help these people? And that was kind of the impetus all along throughout the entire journey of, getting the PhD, finishing the degree, going on through fellowship, getting my first job at the University of Mississippi Medical Center was always rooted in how do I help people? Of course, it's broadened since then. I've picked up a few things along the way to work outside of substance use, just kind of focus on general wellness. Of course, I've had my own therapy practice. So I think really the impetus of it all was just feeling like I was helpless to help other people, and I didn't like that feeling. So that's what started it all.
So how did it morph to working around young people and getting on to first the University of Mississippi Medical Center campus, I guess, and then stepping down even to a body of work that is more largely around undergraduate students? No, I guess not completely. Students are students, but more largely around undergraduate population. How did you get to that point?
So whenever I was in grad school, I got started or actually before grad school, in undergrad, I worked with a lot of different researchers at the University of Missouri. It was all basic science laboratory research, really cool stuff, all related to substance use, but that wasn't for me. I wanted to actually work with people as opposed to study them. So instead of moving in the clinical psych route, I went for the counseling psych side at the University of Missouri and worked for my advisor, who had lots of different protocols, clinical case studies or clinical protocols on young adults in college, and specifically around binge drinking. So how do we intervene on one of the most difficult things to intervene with in this population? So that's where it all started. I was already interested. It really matched up with what I wanted to do. And so my first experience was on an NIH clinical trial, working with folks to help them reduce their alcohol use. And then it kind of broadened a little bit to substance use. And then we worked on another trial for gambling among this population. So high-risk group, people that kind of reminded me of folks that I knew growing up.
Right.
So all that together then led me to seek out an internship related to substance use, which was at the University of Mississippi Medical Center, which had a heavy focus on how do we help people who are either seeking treatment, who are in treatment, with just an abundance of experts in that space. So that all led me up to this point throughout my training.
Well, you're at the right spot if you got started in studying binge drinking. What I don't always have the data, so a lot of times when I'm talking to parents groups, I'll just use the anecdotal hand spread trying to show my chart, and I'll say, okay, parents, you remember when, because they'll focus a lot on addiction. I say, yeah, but a lot of your assaults, a lot of your missed classes, a lot of your pain comes from binge drinking. And I'll say, when I was a youth, binge drinking episodes were about this many per person on a regular basis. Now they're this many. So really your binge episodes have gone up in recent decades. And I'm curious, what did you find in that study? Because I tell everybody, I said, look, even if we didn't tackle the addiction, if we were able to reduce binge episodes among young people, because what happens is you'll take a substance you wouldn't take otherwise, or as I said, sexual assaults, an arrest, missed classes. So many things happen that people then feel shame and guilt about. So they're very costly. They're costly to families. They're costly to individuals. Are there any lessons you learned in this binge study you could leave with us?
Oh, for sure. So it is a huge spectrum. So you couldn't get into the study unless you'd reported at least a couple binge drinking episodes in the past month.
Would you define binge drinking?
Good question.
Thank you for mentioning that. So binge drinking for men is 5 or more drinks in a given occasion, and for women, it's 4 or more drinks in a given occasion. We used to say it had to be in 2 hours, but now we've done the research, and it indicates it doesn't matter if it's in 2 hours. If you've had 5 or 4 in a day, that's a binge drinking episode, because it predicts an increased level of risk related to your drinking.
I'm just thinking of all those college football games. I just watched one down in Austin, Texas. 100,000 in the stands. There was probably another 100,000 outside the stands. They'd show the crowd, and it looked nutty. I'm just thinking, that definition you just gave, 4 more drinks for a female, 5 or more. I'm thinking there were a few binge drinkers in that crowd. Not to pick on Texas, but my point is only to say, in culture at large, we've kind of embedded this binge drinking philosophy. I'll go to my friend's wedding. We will have fun. Code word, we will binge drink. I just turned 21. I will have fun. Code word, we will binge drink. And that doesn't mean for everybody, but there's a lot of it. There's a lot of it.
And when you ask people, do you binge drink? They don't say yes. But when you ask them, do you drink 4 or more or 5 or more, it's much more common than people realize.
Yeah. And I think especially at a school where so many people from the South come to school, where drinking just kind of is a part of your culture, whether you're from Louisiana, Alabama, Georgia, Mississippi, drinking's involved in your culture as early as, elementary school.
People from the Mississippi Delta, and I'm not picking on my friends there, Phoebe, but to your point, I'll go speak at a school over there and some parent will raise their hand. Like in the Mississippi Delta, I mean, we were driving cars in the 6th grade and drinking at our parents had parties and we're drinking, and it just was nobody minded. It wasn't really a thing.
And I think that word of binge drinking has this stigma around it of, okay, well, I'm not sitting in front of my TV just drinking a 12-pack of beer alone. That's like the image that comes to my mind when I think of binge drinking. But then when it's like, no, every date party you go to and you have 4 or more drinks, or every football game or Friday night or Saturday night, it becomes this thing where it's like when you're talking to college students who are like, well, this is just college. This is just being in a sorority or being in a fraternity. What's your advice to them?
I mean, it's a really good point. One of the most common things I hear whenever you ask about drinking in the clinical setting or just with students is, well, I'm a social drinker. It's like, well, I wish that meant that didn't confer any sort of negative outcomes to you because you drink around other people. And, if that were the case, then a lot more people would have a lot less problems than what they do.
Right.
And so that's really the biggest issue you're talking about is, how do we affect the culture, or how do we help people feel like there's something a little bit different than the culture they perceive? One of the big things we try to let people know is, you see it a lot, especially if you're in that social network, but about half to 40% of students on any given time of the year haven't drank in the last month. So there are a lot of people who don't, and then yes, some of those people who haven't drank will then drink later on. And there's a really there's a segment that you're seeing of students when you're at those parties who are drinking a lot. And so then it can also be really easy to think, well, I don't drink as much as they do. So I think it really comes down to understanding, like, what is the culture? How do you fit in it? And most importantly, what do you want to do? Because that gets lost in this grand scheme of things of how do I fit in? What are other people doing? And I know that's a really hard thing to do as a young adult coming to college. That's all you want to do is fit in.
Yeah.
Right. And so
as an adult, even maybe, I mean, you always say, like, I don't need to fit in, but you think, well, I'd like to.
So
it'd be okay if I did.
Exactly. So what are your own values? What are your own goals? Thinking about that, because that can easily get lost whenever you're in just the sea of social connection that you're trying to forge.
And reframing this idea that drinking a lot with friends doesn't end well normally. And there is, like you were saying, I want to hear more about that study you were talking about, how you were saying binge drinking normally leads to negative effects. And instead of, oh, it's Friday night, I'm at the library, this is so fun, all my friends are in town, we're just going to drink, and then I won't drink for a month. Like, what's the relationship between shame, guilt, negative outcomes, and binge drinking?
Oh, yeah, there's definitely a huge connection there. And there's this new term that's kind of floating around. It's real, but a lot of people don't attribute it to alcohol, but hangxiety, right? Yeah. So that next morning when you wake up and it's just the heebie-jeebies.
That was me every day back years ago. I was like, I am not doing this again.
Yes.
I'm not.
And then Friday night comes around again.
And friends call.
And
And you're like, well, I don't want to sit here alone.
Right.
Well, I do want to be with my friends. And they associate, well, this is what we do together. But it's interesting, Phoebe, you note, like, really, if we all look back at our time, how the best relationships are formed with a clear mind. Because if you're having dialogue of people with a clear mind and it goes well and you start sharing things and you learn some vulnerability, that's deep, it's real, and it's connective. When it happens kind of in this substance world, the next day you're enveloped by these feelings. It's like you maybe even committed, let's go do something the next day, and then nobody even wants to because it sounded fun the night before. It just, there's a lot of issues with it. But college students, first of all, you make a good point, Nick, and I tell people that all the time. they will speak to me not just about the University of Mississippi, where I've done a lot of this work, but about other schools and even high schools and campuses where I go. And they speak about young people in general as if they're all doing this. And I always quickly come back to be honest, the data and the anecdotal facts don't bear that out. We're really not seeing an increase in the amount of users. It's about the same. It's static, maybe in some areas slightly declined, right? Certainly surges in vaping and maybe different substances and issues. But I think that story often doesn't get told. I tell people, like, they say, well, what's wrong with young people? I say, well, they're probably not as far off base as you think they are. It's just that there's a lot of education we have to do about the misuse and about, so they understand if for example, they're confused about that, say, using marijuana every day doesn't have any impact on them. Maybe it does, maybe it doesn't, but maybe it does. If they're confused that binge drinking doesn't have an impact on them, it's that kind of education I think that is so important, you know.
Yeah, and it's a changing world too, like you're saying, because, you know, it wasn't that long ago, really, in the grand scheme of things, that I was in high school, and what kids today have access to in high school compared to what, you know, you kind of heard faint rumors about access to pills or other sorts of illicit substances, but you kind of had to go looking.
Right.
Whereas now, I mean, it's there. You know where it is.
It's there. And it's literally in every single community across America. And I think that's why I'm so proud of the University of Mississippi, is that, you know, we've done this with the William Magee Center. We've built this center that is there as an advocate for students in education. And when a student struggles, or if they have a peer that's struggling, they can reach out to the Magee Center, and you and the amazing staff, and I do mean amazing staff, are able to help them navigate, connect them to the paths to figure out what they need to do academically to solve it. If they need counseling, you can help with referrals there, right? The full spectrum. I always say it's like in cancer work, where many years ago they realized you can't just be trying to track down all of the ones you need to go. We need to look at this from a concierge standpoint, really. And I think that's what the William Magee Center is. Its strength is. And I'm very proud of the University of Mississippi for having the courage as this game has changed, realizing it's not a reflection of us, it's just students. I mean, this is a collection of community, and our job is to support them in what they face in community.
Absolutely. And I feel like Ole Miss sometimes gets such a bad rap about being a party school.
But you know, Phoebe, the good thing is, and I promise this is just my selfishness that I attribute the Magee Center to this, but you know, when I was young, Ole Miss made the party list all the time. Lately, the party list comes out, and I'm looking at it, and we're either not on it or we're dipping down, you know. But so we still get that rap, and I think a lot of your SEC type schools do. You know, you get a lot of out-of-state students, you get a lot of attention.
Right. But I think that's one of the most beautiful things about the William Magee Center is they've gone into a space of need. It's not, we're on this small liberal arts campus where people don't really drink. There's not a big Greek life. There's not a lot of partying or that kind of culture. But I love that the William Magee Center is in a space that needs it, that needs access. And when these people are helped, their lives are turned around, not when they're 35 or 40 or after 2 divorces and all of that, just when they're 18 or when they're 19, or they're educated early on about the risks.
And we have students, Phoebe, that they have watched blossom through the Magee Center, that I have been blessed to get to watch and, you know, just emerge and change. And as I always talk about the knocks in the door and students saying, you know, you saved my life, and my line, and I know I'm repeating myself, people will say to me, well, I know it doesn't make it all better having lost your son, William. And I'm like, oh, you'd be surprised how close it comes. It does make all the difference. It absolutely does. And, you know, as you talk about, though, it's not just substance misuse. There's also eating disorder. You know, my daughter and I spoke at one of the larger sororities some years ago, and the amount of young women that came forth, and in fact, I still hear from them 3 years later, that were battling prevalence of eating disorder. And again, that's not just at this university. That's everywhere.
Mhm.
And it is such a everything really, Nick, in the mental health spectrum is what you guys have to take your blinders off and really be open to be able to serve, right?
It's honestly been, I thought becoming a licensed psychologist, that's the pinnacle. This is so much harder because, I had my specialty area. I had my kind of my box that I worked in, and now it's everything. And, of course, I always want to note my limitations, but it also means that I've got to work harder to stay up to date on all the things so I don't, lead my staff astray who then lead students astray. So, yeah, it is all the things. But the good part is kind of the same things that have always been true about how to support wellness are still true. And it's just a matter of how do we get that message out to people.
What trends have you seen with the students at Ole Miss? What are a lot of people?
Or in students at large in some of the other work you've done?
Yeah, I think one of the things that, I've been thinking about lately, and I know, David, you've written about this, you talk about it, is cannabis-related negative events, however you want to describe that. There's probably a better term for it. But
no, that's a pretty good one. It's accurate. Cannabis-related negative events.
Sure.
I see a lot of those,
Right.
yes.
And I think one of the interesting things is you'll hear from people talking about, and maybe this is true sometimes, but I suspect it's hardly ever true, is talking about, I think the marijuana that I got was laced. And it's actually, the toxicology report comes back or whatever, it's not laced.
It's not.
It's just stronger than it ever has been before.
Well said.
And you're having a horrible reaction to it. So I think there's a lot of, if I could just implant knowledge in people's head and I could pick one topic, it would be that, you do whatever you want to do. Your choice is up to you. But what we know is that cannabis products, when used in the ways that people are using them recreationally, well above and beyond, recreational use, is not helpful to you, more than likely.
Yes.
If I could just have people understand that and know that there are very significant risks, or, for example, more and more students and young people reporting the vomiting disorder that develops from cannabis use. It's horrifying.
I mean, and they're showing up at the emergency rooms across the country where colleges are in large numbers. And they tell me, the physicians there tell me that's usually what it's related to, more times than not. So I'm with you there because I actually share the same thing. If I'm often asked if you could do one thing, because I get this over and over. I got one just 3 days ago. A mother calls me. Here's the way this goes. A mother calls me. My son is struggling. I mean, he doesn't use substances. Well, he's definitely, using weed daily. And I always say the same thing. Look, I'm not judging. I don't care, but I'm pretty sure that there's some things going on with the strength of that. Maybe their personality doesn't match with these strains. I think that if you were to dig deeper there, you might find something, and that's usually information to them. They think their child is self-medicating to benefit what they're facing, but yet they're explaining that in recent years, as their use has increased, their behavior is altered more. And it's pretty common. You have actually done cannabis-related research, which goes to the next point. I'm also often asked, what's the biggest hurdle you face? Let me tell you what it is. Any parent listening, by far, when I have these parents come forth and they have a child struggling with THC disorder, we'll call it, they and their child are almost exclusively resistant to treatment because they don't think in that bucket it matters. Now, you've done research on this.
It's really, really, really hard from the research we did. What we found is to get people to seek that treatment out. Even when you try to break it down in different ways, and people just don't perceive the consequences they experience from cannabis.
Mm-hmm.
They don't attribute it to their use. And what's really scary is I think this was the most enlightening information that I got that was taught to me, is so if you open up the DSM-5, all our big book of diagnoses that psychologists and psychiatrists and counselors use, and you look at cannabis withdrawal, which first of all, for a lot of people, you're thinking, you can't withdraw from cannabis.
Right.
Oh, yes, you can.
Mm-hmm.
And when you look at it, you see what are the symptoms? Anxiety, mood concerns, appetite problems. And then you ask people, why do you continue to use? Well, it helps me with my anxiety. It helps me with my mood. And, with alcohol, no one would ever say that, right?
Right.
No, they would not.
Yeah.
And that's interesting. And that's what I've started saying back to some of these students and mothers. And again, they come from all over the country, because I'll hear from them. And this one that contacted me 2-3 days ago, they were from North Carolina. And the line I say back is, I'm like, look, I mean, if they were drinking a case of light beers daily they got at the local grocery store, you're not even resisting treatment. That's something you would at least understand, I think. And they go, yeah. I said, why are you missing on this one? It's not picking on the substance. I don't care. I always tell people, legal, not legal, but sure. I'm not talking about recreational use. This is people's own judgment, their own decision. But somehow misuse and adverse effects, we understand what they are with alcohol. They're largely ignored, but we understand what they are culturally. And we understand the adverse effects generally with fentanyl and or cocaine or whatever. And what I just try to help them understand is this is still a drug that you are putting into your body and brain on a repeated basis that is very strong. And it's just, as you say, Nick, it's about the education. So I think we have a lot of work to do, because frankly, let's be honest, I wish on a university campus you could just wave a wand and infiltrate that into their brains. But the truth of the matter is, a lot of that work does have to be done earlier, because a lot of that, with my two sons, I mean, they were late middle school. I mean, they had made decisions that marijuana was almost good for you, and they were into regular use with their friends, and that by the time they got in college, that was a pretty difficult conversation.
Yeah. So what do you say to people who do have this argument that marijuana isn't addictive and it is good for you and it's better than drinking?
If it's someone who's coming to me for help, it's a very different story than if I'm trying to educate an audience, right? So if someone's coming to me for help, just like David mentioned, I'm not going to judge you. I'm not necessarily going to correct you. I'm going to look to see if there's any inconsistencies with your values and the way you're using cannabis, and if you're connecting any sort of negative outcomes to getting in the way of who you want to be. Now, if I'm going to talk to a group of people, I'm really just going to bring up the evidence out there, because a lot of people will say, well, research has shown, and maybe a study or two here and there, but when you really drill down, and you could actually ask some of the faculty members here at Ole Miss who study different compounds within, cannabis itself, because in the marijuana plant, people don't realize there's 500 different compounds. We know about like 5 of them. I'm probably getting that number wrong, but it's not very many more. So one of the things that I like to share that we're learning or do know is that there's only probably about 2 or 3 things we know for sure that THC and cannabis products actually help you with, and it's not the THC plant or the cannabis and marijuana plant. It's the breakdown for like CBD for infant seizures, and other substances for cancer patients and folks who have poor appetite. So the list is really small. There's just no data there to actually support that this helps you. Now, some people report anecdotal, hey, this makes me feel better, and it's really hard to argue against that, right? Like that's someone's own personal experience. But if that's the only basis for why this is helpful to you, me as a practitioner, scientist, that's not nearly reaching the bar for me to say, hey, this is something that I would suggest you should actually do. I think that's really the main part of it, is there's just no reliable research that shows how effective it is for the things that people say it's effective for.
Yeah, that's what I tell students. I'm saying, like, the information is there. It's there. If you think this is benefiting you, go do some research and show me that list. you know,
Mhm.
and I've actually had real success with that. It's just not information culturally. They have been, because most of their parents' generation, it literally has changed. It's 400 to 500% stronger than it was, 20 years ago. So they're not able to get the education at home because it's not the same product they're getting on the street that maybe their parents were some years before. So it's doing different things to them. It is much more literally addictive. It is harder to quit, and it has more intricate impacts on your whole physiology. Sorry. We'll strike that
That was a
word.
big
Yeah, I don't know. We don't have to strike that, but that's a big word. But it does, and like I tell them, like, you don't understand all the levels of what this is doing to you, because they come to me and they're paralyzed, and they look sick. They are sick. They feel sick, and that is the last thing that they would put their finger on that they think it is. And I try to say, let's not focus on THC as a thing, meaning. If you were taking in that much cough syrup, or if you were taking in that much alcohol, or if you were taking in that much Xanax or whatever, is it illogical to think that if you're pouring substances onto your brain, any substance, that it will alter how you feel? Period. And I think that's where the education begins. So, Nick, parents are a unique situation in the college environment and university environment, because really you can't be talking to them, right? If they have a student at the university, Phoebe just graduated and she was a model student, but let's just say her parent, let's say she had been facing something last year as a senior, and her parents had wanted to call. It's not that you couldn't talk to them, but you maybe can't talk to them about the specific of their child, right? But parents still have such an important role. So what advice, just looking at the mental health spectrum in general, for young people and youth, what advice do you have for parents, just in terms of how can they best help their teen succeed? What can they do? Are there specific tips, or just things they can do in general?
I mean, I think one of the things I think of first is, and yes, FERPA is the term that all of us administrators talk about. So lots of well-meaning, well-intentioned, caring parents calling about students, and then we're saying, I'm so sorry, I can't talk to you about that, and I can't even confirm that, this person's been here for that thing, which it's for parents to know, if that does come up, that's really challenging for us administrators too.
I have explained that to parents. I'm like, nobody, it's challenging on both sides, but that you didn't write the law.
Exactly. Exactly. Well, we certainly have to follow it. That's for sure. So I think one of the things, it's very broad, is, if you've got, somebody, your child's about to be a freshman, you're sending them off, maybe you're sending them across state lines a long ways away. I think it's challenging to, and this is speaking as someone who's not a parent, but I think it's a challenge to, how do you support your students' autonomy and making their own voice heard? How do you empower your child to reach out for help? That's one of the biggest things we see, is students who are struggling but don't know how to reach out, don't know who to ask for help. And when, you hit that magical age of 18 and now we can't talk freely to your parents, it really is up to your child to be able to seek out those different resources on campus. And admittedly, it's a challenging landscape to navigate, which is why I think what we do at the William Magee Center is so important, because we help people do that themselves. But I think that would be the first thing I recommend, is how do you help your student figure out, maybe it's empowering them to call somebody on campus ahead of time if you know they have mental health concerns. Make that first call to the counseling center. Just reach out. Show them the ropes so they can do it once they get here.
That's great. What about the students who don't necessarily think they need help?
Oh, yeah. I mean, gosh. So most students are struggling, I'd say. That's, I think, where, from the parent side of things, where, David, I know you talk about this a lot, is how do you keep, a listening ear available? And how do you point things out to your children that's not, like in a pecking, pointing type of way of, you need to go get this figured out, or go talk to somebody, but listening in that non-judgmental, open-ended way, softly letting, if you're noticing things, and that's a hard thing too as a parent, is to say, hey, it seems like you're struggling. That's a hard thing to admit. on the parent side of things. But so if you're noticing that, letting your students, letting your children know that it's okay to reach out for that. So normalizing that process, which I know for some folks is a really hard thing to do. Mental health stigma is dropping, but there's still folks.
The bar's still high.
Yeah.
It's dropping, but it's still high.
Yeah.
And I find that it's dropping in some areas. Anxiety, as I talk about a lot, is the safe word. Everybody's safe in anxiety, saying, I struggle with anxiety. They can say that to their parent. Your generation, you know that, right, Phoebe?
But then when depression enters the conversation, OCD, eating disorders, it's like, well, it's much easier to just say, I have anxiety.
I have anxiety. And nobody really wants to start breaking it off from there. It's just harder to convey that. Harder to even say it to ourselves, you know. But on that note, Phoebe, I think that in high schools and colleges and universities and different families that I talk to, I would say across the board. Across the board, I think that 100% of the students I encounter are either going through something or have gone through something in the past year. Statistically, it's probably close to 50% at any one time. And I say, you know, I don't know. It feels to me, based on what I see, that it's more like 100% at some level. And some of those are minor things. But am I wrong? I mean, you've just come out of environments of large numbers of college students. I mean, am I wrong in that?
No, definitely not. And I think the transition from college to out of college is so difficult because you go from this blossoming social network where you can binge drink on a Tuesday and no one says anything. And you laugh about it at lunch the next day, and you are going home with boys you don't know, or you're trying out substances because you have that safe code of, I'm in college, I'm exploring, I'm experimenting. And then you go out of college and you realize none of that was normal.
None of that was
normal. And it was all kind of in this pressure cooker of, you're in this, you know, petri dish of comparison, of success, of pressure, of school, of academics. And of course, people are going to try and get out of that in ways and connect with people. But I think that's something I've realized is that wasn't normal. And it was not healthy. And
and it makes transitioning hard.
So
because
hard.
You've been living in. And I've told some young person graduating before, you know, they're out there living this big life, and all their friends like, this is our time. So they're going to the bar every spring day. And I'm like, you do understand, like, 1 minute that's normal, just as Phoebe's saying. That's such a great point. You get your diploma and you go take a job. The next minute, that actually kind of looks like problematic behavior.
Right. It starts to be like, oh, am I an alcoholic? Is rehab necessary? And then it's like, wait, no, I did this all the time. This isn't a big deal. And so I think hearing you say binge drinking is 4 drinks, that was like minimum for a lot of people I knew in the environments I was in. You didn't have a night where you didn't have at least 4 drinks.
That was in the pregame.
That was the pregame. You'd have 4 drinks, and that was normal. And so someone who is trying to drink responsibly gets so like, okay, well, why am I trying to do this if everyone is doing this and it's perceived as normal? And so I also think alcohol is kind of, in a way, kind of like anxiety, where it's just kind of, oh yeah, I drink. Yeah, I drink. But when you bring weed into the equation, it feels a little heavier, at least for people in my group, where it was like, I'm not doing a drug. It's just alcohol.
It's just alcohol.
But then, you know, we would be using it excessively because we didn't know that binge drinking is not healthy. And that is binge drinking.
100% it is.
And so I think that is so interesting, of just even having the definition for binge drinking. It's not sitting alone on your living room, depressed, drinking a 12-pack of Miller Lights. It's having 2 high noons at the pregame and then 2 high noons at the day party. And that is literally... most people
fits.
at Ole Miss who are in Greek life.
And it is such a part of the culture that it feels like you're supposed to do it. But what gets lost in the education is, you know, the human body, when that alcohol comes off, a lot of people will feel some mild depression the next day.
Yeah.
But a lot of people will feel more than a little bit of mildness, and they struggle sometimes to put their finger on it. So I will have a person come to me and they'll say, I'm just feeling, and I'll say, well, what if you feeling blue? And I can't put a finger on it. I've never really experienced these kind of things before. So I'll usually try to get to asking them questions to find out, have your binge drinking episodes increased? And a lot of times they have. Say in high school, maybe they did it a few times experimenting, and let's say in college it's 3 times a week, and they're kind of going through a little bit of depressive behavior. I will usually always try to go there. I'll say, like, I'm not saying that's it. What I'm saying is you have to start there and start removing things and be able to assess, is that it? Because it can have an impact on you beyond just the time when it's happening,
Can you tell me, I just want to hear more from your research standpoint of what do you know about anxiety and its effects? And
it's real.
Yeah. It's me. That was a very common word
It's
used
real.
where
Was
we would
it?
wake up and everyone had anxiety.
Everybody had it, but I'm going to be real interested in his answer. Everybody had it, but the irony is they'd go back for more.
Right. Yeah.
And nobody ever stopped to go, like, why are we talking about this? And we keep repeating
maybe we shouldn't celebrate this.
Maybe
if it's what's making us
Maybe
feel
we should go
awful.
bowling with Diet Cokes instead.
Right.
I think what people don't realize, so anxiety kind of falls into everything related to a hangover that people haven't normally attributed to a hangover. And what most people don't realize about a hangover is that is actually acute withdrawal from alcohol. So that means you drank enough to where your body in a very short term, so it's not the same as, someone who's drank for a really long time and is withdrawing from a substance. But in that short term, your body is kind of feeling like, ooh, I was used to alcohol and it's not here. So anxiety, pain tolerance, weirdly enough, general mood, all these different things that are affected in the short term. And that's why hair of the dog drinking alleviates your feelings, because you're alleviating the withdrawal symptoms. So again, and that's something to be celebrated too. It's Sunday brunch, right?
Absolutely.
So we kind of normalize all these things and it makes us feel better. But the facts behind it are,
we put romantic names on those Bloody Marys and those breakfasts, but it's really alleviate your alcohol withdrawal. So get rid of your anxiety and your physical alcohol withdrawal. Come here.
Yeah. So really, it's a part of the whole spectrum of a hangover. And that there's lots of other things that we just don't notice, but anxiety is just one of those things.
Yeah. And what do you think it looks like for someone to drink responsibly in college? And do you think it's possible, or do you think people should just kind of refrain from it? I
think it's totally possible to drink responsibly. We know almost, I won't say for sure, I won't call it a law or a fact or proven. I was told getting my degree, you probably shouldn't say that in my profession. But we have really good data to show your social network is probably the biggest factor that influences the way that you drink. So not only do we have kind of correlational data, so are these people in these groups drink more or less? So we have that, but we also have this really cool research that shows as you go through time in your college career, if you track into environments that drink more, your drinking goes up. And then and what's really cool about this research is some of those people leave, but their drinking actually goes down as they leave these environments. So
interesting. So it's not that it can't be undone.
Exactly.
It's all about the company you keep. I heard that when I was young. It's still a thing.
Believe it or not, the research backs it up. Absolutely.
Wow.
That's
so interesting.
That is interesting. And we talk a lot about, and we had our son Hudson on here, and he's allowed us to share his story a lot. He changed his company when he got sober as a college sophomore. Didn't mean he still didn't love these other people.
Right.
Didn't mean, but oh, by the way, a lot of those people in his group that he changed out of for a while, a lot of them are now sober, by the way, I should say. But for a period, he had to change the company he kept. And he says over and over again, that's really what saved him and helped him find life as a young, sober person. But it doesn't have what you're saying, and this is important for everybody listening. I think it's important for grown men also, because I have a story on that. In 2007, I thought, I'm not sure alcohol is great in my life. I'm going to stop. And I did. And in some ways, it was really good. I wrote a book that I still get royalty checks from today. So obviously I did something well with that. I was able to quit, but here's the kicker. I didn't change much in my life. I kept the same friends who still drank a lot. And I tried to keep a lot of the same habits. So I didn't change me. I tried to reduce one thing. So I was able to achieve it for a year without much work, but I was not that happy because I didn't change my environment. So when I started drinking again, I'm among all my friends and I'm still in the same group. And guess what happened? I drank more. And then we all know how that ended. It went poorly and it crashed and burned. So I think that you just spoke something that really got my attention, because if I look at my life and I look at, like, say, a junior and senior in high school, after I'd started drinking in 10th grade, I changed my environment and I had this new group of friends and this girlfriend who didn't drink and all that. And guess what I did not do? I did not drink. And I was so happy. I was so happy. The company you keep, it's real. And it's important that I tell people all the time, and it's one of the things, I love your answer so much. The William Magee Center, we're not saying don't have fun. Yeah. You're not saying you can't drink. That was such a good question, Phoebe. Can you drink responsibly? Can a young person? The answer is yes. An adult can. Somebody 21 can. Of course you can. But it may look different than binging 4 times a week.
Yeah, what looks normal, that's a really good point, is if it looks normal to you to binge, then it probably actually means overall statistically it's not normal. I mean, just based on the 50th percentile. But it is really amazing how much of an effect the people around you. I think that's the reason why, in the recovery community, you often hear people, places, and things. People comes first.
Right.
Yeah, that's so true. And I think sometimes in those groups, there can be people who might be drinking a lot more than other people, but they're surrounded by drinking. What kind of conversation what do you think a conversation looks like for maybe a friend to reach out to another friend and maybe bring up, hey, you've been drinking more? What conversation tips do you have that make those interactions really effective?
Yeah, and I mean, first of all, that's an amazing friend who's willing to reach out. I think a lot of folks, the first thing is actually try that, do that. I mean, so even if you do it really poorly, the fact that you're doing it at all, I would say, great. What would I recommend to make it most effective? Always use facts and also share how you feel personally. That always matters to people, because then it becomes less of a trial and more of a, oh no, my friend who cares about me is worried about me.
Right.
Yes. And you can understand I'm hurting them. I'm causing them pain. Not just like, well, I'm just doing this because it's my life. I'll do whatever I want. Yeah, but you're kind of stepping into my life and it's hurting me. And I don't enjoy these feelings. It's hard to watch.
Yeah, so really personalizing it about how it makes you feel, remove all of that potential negative judgment that can come out, because a lot of times people wait until they've had a lot of either negative things happen to them or when judgment's built up about the other person's behavior. But make it about your own feelings, but also use facts, use what you've noticed, and let that other person respond accordingly, and be prepared for it not to go well the first time.
That I give that all the time. I'll have parents call me and they said, or a peer even, they said, well, I've tried this several times and I can't do it again. I said, no, sometimes it takes like 8 or 10 even, but you have to keep trying and eventually they'll see a reflection. They really will, but they only don't see the reflection when everybody gives up on them. And I'm not a big fan of giving up, because I see people break through. I mean, I've been able to do it with people 40 years later. And what happened is a lot of the folks around them just thought it wouldn't work and they gave up. So you just have to keep trying, keep letting them hear the message, which is you matter. And my relationship with you matters.
And that's why I'm bringing this up.
And I'm here because I care about you.
Yeah.
And eventually, a lot of times they hear it.
Yeah.
So Nick, in the student world, we talk a lot about telehealth. In the mental health world particularly, telehealth, I think we found is particularly useful. It can allow, we'll have students come from a hometown and they'll still use a counselor back in their home through telehealth. I see that a lot. And I'll often also see a young person who's maybe not as quick to walk into a facility, be it the University of Mississippi Counseling Center or the William Magee Center for AOD and Wellness Education, but perhaps if they have access to it, they might start up with some telehealth. You've done some research around telehealth.
Mm-hmm.
What are your thoughts on that? Is it effective? Is it the future in how we meet students? Tell me your thoughts on telehealth.
Oh gosh, it's such a nuanced conversation that I think a lot of times gets broken down into very polarized, and it's not. Is it effective for some people for some things? Yes. Do some people not prefer it? Absolutely not. So we did some research that I headed up right after. Well, really in the middle of the pandemic. So this state government came to us. Actually, they came to the hospital and said, here's this tiny chunk of money, provide services to the whole state. And my administrators back when I was working at the medical center in Jackson said, how about we do a research study to see what's actually going on with mental health? And so we focused on college students. What we found in the survey we gave out is that most people actually either had a neutral opinion of it or were actually maybe either more interested in it or were just fine with it. There were a few people who said, I will never use a telehealth platform. And those people are important, and they can certainly use their traditional services. Right. But there was another number of students, like I said, that actually said, I only want to use telehealth. This is the only thing I'm interested in. And who knows, maybe it's changed since then among that group of people. But I think the most important thing we found is it was very favorable towards telehealth. And that was among people who were currently using services and people who weren't yet but were interested in it. So we really captured a huge swath of students across the state. And it seems like it's a good service to provide.
Yeah, because it may be, let's take some parts of the state of Mississippi and or neighboring states like Alabama and Louisiana, when you have very rural areas. They don't have, I spoke at a school in the Delta a couple of years ago, and it was, I really connected and I felt it, and when you do. And I remember a line of students lined up, and I remember getting out of there, and the head of school called me afterward and said, well, good job. Bad for us. We have all these students now ready for counseling. We don't have the infrastructure of counselors. We have like 2 in our entire community, and they can't get in. And I was like, whoa. Yeah, I mean, you have to look when you deal with mental health. It's so easy to think of it's one solution, but it runs deeper. And so maybe telehealth, sure, some people don't have any interest in it. Maybe it is polarizing in some respects. But what we know is, particularly around some young people and or other folks who have lack of access, it can create some access to mental health counseling and treatment that they're just not otherwise going to get.
Yeah, the normalcy now is a wait list around you and your community. So that's just a fact of life. So increasing access is just a public health benefit.
It's only a public health benefit.
Right, because I know so many people who have gone and reached out to specific counselors or mental health providers, and there's a wait list, and they're like, okay, well,
then the moment passes.
Then, oh wait, I'm actually fine.
Yeah.
Like, or when
I've
you
seen
get
it too
off
many times,
when you
Phoebe.
get off the wait list, it's like, oh well, the breakup has passed. Like, I don't really need it anymore.
I don't need it now. Which in the reality, and look, the access to mental health is probably the number one thing facing a state like Mississippi. And I tell families that all the time. They want to look to us at university, but so much of what the William Magee Center has to do is provide support. We still have to understand that the dynamics of community, of family and community and schools leading up to the university, that's
Absolutely.
really the foundation of where a lot of our problem solving has to come.
Absolutely.
I think this whole point is really shaping this conversation that we're having. Really highlights one of the biggest reasons why, aside from it was my interest and my dream, one of the biggest reasons why I'm not, solely licensed psychologist practicing, seeing patients is there was always somebody else behind the person that I was treating.
Oh, yeah.
There's always somebody else. And so I don't know why, it just bothered me. How do we help more people? How do we get this stuff out there? And so if we can't, provide an infinite amount of treatment, we've got to start providing more prevention and education and getting the
Absolutely.
message out to everybody. So I think that's, what I'm so proud of that we have here and that we've started is that we're working on that angle now. How do we keep people out of the system who don't need to be there?
Right.
How do we help them earlier?
and create a language for it
Mhm.
of, you know,
an approachable language where
Yes.
students are, and I won't call the name, Phoebe, of this other university, but there's another university that has well-intentioned and good people work there, but another university somewhere in the country that has something similar to the Magee Center, and their people are always saying, well, how do we get it like the Magee Center? Because they feel like we're doing something better, because what you just said, the messaging of approachability is so important.
Right.
You have to speak the same language. If you're not
Right.
meeting them where they are, you can have a center and you can say you're doing it, but you're not crossing the transom to be in the
Right.
field where they are.
Right. And everyone wants wellness, you
Mhm.
know, general wellness.
Mhm.
And so I think
Everybody.
as a student, hearing, oh, yeah, I went to the Magee Center, I was like, oh, yeah, cool. It could be about
Yeah.
stress.
Yes.
It could be about depression. It could
Mhm.
be about suicidal ideation. It could be about addiction. It was kind of this huge umbrella where you were still anonymous. You
Mhm.
know, if you were going to counseling, people weren't like, what's wrong with you? It was like, oh, well, yeah, of course you are. Because now
Yeah.
people in my generation are really starting to celebrate that because it's just become normal. And it's, you know, I am not necessarily struggling with any serious mental health issue, but I go to therapy once a month.
Mhm.
And every
you're
single
getting ahead of it in
right.
ways, right?
Every
It's
time I leave,
maintenance.
I know myself better and know my patterns of, okay,
Mhm.
when am I likely to slip up? You know, is it more likely when alcohol's involved or loneliness or any of this, and putting language and faces to these different parts of myself, and when they come out is just good, and it is prevention. And so I think a lot of people think, you know, getting help is only when you're in the thick of it, but a lot of it can be preventative.
And sometimes it's harder when you're just in the bottom of the thick of it, because you have so
Right.
much to unpack. That's I love that. That's good advice, Nick. The bottom line is we're doing groundbreaking work with the William Magee Center for AOD and Wellness Education. We're so thankful for you. You have an amazing team. Every time I walk in there, the team and their knowledge and their enthusiasm, it gives me chill bumps down to feeling the tears that I felt when I knew you were going to take this job. Where do you see this journey? Not even just at the William Magee Center, but as far as how do we better connect with students and families in trying to help them in a mental health journey? I mean, where are we going in the future with this?
So I think I would have never have told you this 5 years ago. And then somebody told me about Dear William. And I read the book, I hear the story, and I connect the pieces to my own life of wanting to help people and experiencing pain. And I know we've talked about this. I have seen so much change in people from hearing a story, listening to a story that connects to you. That does more, and this is where I'm just going to admit where I can't do all the things. That does so much more than what I can do in my, my evidence-based interventions and communication style that I spent, what feels like a million years learning. A well-crafted story that is personal, genuine, and meaningful does so much to connect to people, because to the points made earlier, how do you help someone who doesn't know they need help? Well, if they can see themselves in the story, all of a sudden they can reach out for help. And so I think that genuinely, I do think that's the future, is how do we help people tell stories, hear stories, and connect to real meaningful things.
Oh, you've come to the right place. Oh, you have come to the right
We
place.
should change the byline of a little crazy to whatever he just said.
Yes, Phoebe, he's come to listen. And you've actually done research in this area, because I know some of your trauma research for PTSD and stuff has been around storytelling and people putting themselves into the narrative. So you actually have work around this.
Yeah, it's very specific and really kind of a small box in terms of the world of storytelling. But what's amazing is we're finding this out. You got to give people really specific instructions. They have to write about it in a certain way. But we're learning that through this new method called written exposure, where me as a therapist, I don't even talk to you about what happened to you. In fact, a part of the protocol is I don't. I just asked you how the writing was. So all you do is write. And what we're finding is, and this is amazing, and I can't take credit for the original part of this research. This is Denise Sloan, Brian Marks up in Boston doing this amazing work and spreading it out to the masses, is that if we have you write about this for 30 minutes for the course of, 4, 6, 8 weeks, we treat your PTSD to remission. So it's gone. And we have treatments that can do
Wow.
that, but this one might be double in terms of how fast it works.
Whoa.
And guess what?
Yeah.
Less people drop out of treatment because can you
Right.
imagine how fun it is to write about the worst possible thing that's ever happened to you?
Yeah.
Right.
Or talk about it. So all the
I've
other...
actually done it.
Right? Exactly. There is
But I
something...
live to tell about it.
There's a healing aspect to writing and going where you don't want to go.
Yeah.
Mm.
Mhm.
That's so beautiful. I'm speaking this storytelling thing, and that'll be a good way to end this episode. That we're going to have a back porch short conversation of something fun in just a second, but we'll end on that note. And I will say I feel so strongly about it because I'm always trying to work my way back as well. And we've had a lot of conversations, and you've read a lot of what I've been written, and I'm a learner, and it takes me a minute to get there. I'm a top line strategic in all the personality tests I take, and so I kind of obsess over strategy.
Mhm.
So I've obsessed over the strategy of how do we reach people and actually have community change.
Mhm.
And what I found is, like I said, I'll go into a school, I get them all mushy and ready, and they have 2 counselors. Okay, so sure, we need some more telehealth. All right, but then I find out that's still not enough. And recently, so I'm going to this school in a week or two, and so now I've started turning the chapter. So they call me and they say, okay, we're having you down. You'll meet with all our students. You'll meet with all our parents. David, is there any one thing else that we could do? I said, actually, now I do.
Mm.
How about you go get with your school counselor and go consult any other experts and go get your English teachers or staff, and why don't you assign some introspective writing to follow up with this? But go consult some experts. I don't have all your answer. And it was, I wish you could have heard on the phone what I heard. I mean, there was 2 or 3 people on the phone on the other line, and you just realize magic just happened. I mean, they've been in the education business for a long time, and we're all out there grappling. And what we found is a solution that doesn't require, we need 16 more counselors, we need $1 million. Guess what? They already have the infrastructure. They already have now certainly there's going to be to really get the best results, there needs to be professional guidance around that and professional advice. That's where the university can do. That's what things like the William Magee Center and the Magee Institute and so many others, I think, can do. He is Dr. Nick McAfee. He is director of the William Magee Center for AOD, and I'll cry because, AOD and Wellness Education, because it is a reality. It's real. It helps students at the University of Mississippi every day. And Nick, you help us on a conversation like this. But we're not done yet. We have a conversation called The Back Porch, and only special guests, it's usually sometimes Phoebe and I, only special guests get invited to that. Be thinking we're going to talk about some of our favorite foods in Oxford, Mississippi. This is the back porch conversation I've been waiting to have. I just needed to have the right group. So I grew up in Oxford, and this was never really a food town when I was growing up. I mean, we could go to the Cream Cup and get little soy burgers and or a soft serve ice cream cone. We did have some great spots like Dino's Pizza. You'd go in there after we'd win a basketball game. Rarely. We didn't win a lot of basketball in those days, but you'd go in there and get a Dino's Pizza, this little doughy crust cut in little squares, and people would be playing Queen on the jukebox, and you'd think that sounded fun. Now we're kind of a food town in a way, even though it's a small community. There's some great food here. So ladies always get to go first. Phoebe, we'll put you on the spot. What's your go-to if you need something you just like? What's a favorite food in Oxford, Mississippi?
Well, I grew up outside of Atlanta, so I grew up in like strip mall topia, where everything was chain. So my standard of cuisine was like Chick-fil-A, Zaxby's.
Your former employer.
My former employer. And then I came to Oxford and I was like, wait a second. There's food here, like local food that people care about. And so whenever my parents come in town, we always just eat through town. I'm like,
fun.
okay, what's the next restaurant we can go to? But I love anywhere with a patio. So I love Jinsei, Wing Wednesday. They've got great food. And St. Leo's always good.
Yeah.
But South Depot, I think, is my
Yeah,
favorite.
I had it. I was guessing you were going to say South Depot.
It's just the patio.
Okay, you go to the patio
so nice.
out back?
Yes, me and my friends will sit out on the patio.
And do you get a burrito or a bowl?
bowl?
You get a
I'm a bowl
bowl
girl.
and rice, chicken. What
Beans,
goes on it? Okay.
Cilantro,
Okay.
onion.
Yeah,
queso.
you get a bowl.
Always get some queso.
South Depot.
I love
and some
it,
cheese,
yeah.
and sit on the patio.
And sit on the patio.
I like outdoor dining, and so that's another thing. For a lot of years, we had no outdoor dining in Oxford, only in recent years, and now it's still just tiny places. That blows people away. Like, a lot of the seating has just been added in recent years after the pandemic on the square, and then the little patio there. Whereas other cities were kind of made that way. Oxford, when we were all in school, I mean, it was just kind of like get inside of the air conditioning, and there was no out. But I'm a big outdoor. All right, Nick, and Nick has a wife that also enjoys cooking and does. So he's kind of spoiled by food. They taste their way across Oxford, and your favorites are what?
Yeah, you spoiled times a million. But I would say probably my number one, if I had to pick one, because it is hard, our main place, and that's my wife and I'll speak for my wife because I know she feels this way. Normally I wouldn't. I'd say St. Leo. St. Leo's our stop.
So good.
Yeah, it's way on
if
my
you
list.
can get in.
Yeah,
if you can get in.
Yeah, that's true. But I don't know. Sometimes we joke about that.
You go early like I do. You always get in.
We're old souls. We like to go at lunch around 11 o'clock,
Same.
get in there. But, normally you overlook things like a salad. St. Leo is just everything you
gosh.
order.
Fantastic salad.
One of the best I've ever
salad
had.
the chopped salad.
And one female-owned business, Emily Blunt, and her husband, of course, Daniel. But she runs it. She's my neighbor, and she's my friend. And I remember when she came here to open it, I said, we've been waiting for some female powerhouse restaurateur to come in here. And let me tell you, she's delivered on it, and then some. And then she has her sister-in-law who also works there, and so it's a real family affair. You know? So mine. I'm going to end this on one that's going to throw you two newbies to Oxford for a loop. So my favorite Oxford food no longer exists. And it's not Dino's, as I talked about. But you'll understand why I love it and why I need something like this to come back. So in the 1990s, it was so ahead of its time. Oxford wasn't really happening. I mean, Square Books was happening. And Proud Larry's was long since happening. But some friends, one friend in particular, opened a great vegetarian restaurant called Harvest Cafe on the square. I didn't think you'd heard of Harvest Cafe. Harvest Cafe, our sound engineers certainly heard of Harvest Cafe, of course. And it was phenomenal. And we would eat there like 3 times a week, lasagna, great salads, incredibly well run, very hands-on. And the thing is, it was ahead of its time. And it was one of our very best restaurants in Oxford that we have ever seen. And they did well, but if that type of place, if Harvest Cafe, these breads they made, I mean, they were unbelievable. If Harvest Cafe was here now, you couldn't get in the door. It was just ahead of its time, so it made about a 5-year run, and then it was gone.
R.I.P.
That's it. I know, R.I.P. But one day we'll get one back. I see these places at other, in other communities, and we'll get it back. We are a little crazy. Sign up for our Substack. Go sign up for our newsletter at alittlecrazy.com. It's easy to find, alittlecrazy.com. If you listen to our podcast right now, wherever you listen, on Apple or Spotify, go like it. Give us a rating, like it. It does matter. It does matter. We need that. alittlecrazy.com. Like us, follow us, find us on social, and tell your friends. And by all means, come back for next week.